Hello. Making sure babies and moms get a healthy start is the purpose of one local organization. We'll hear what they do to support moms and babies and all about their upcoming gala. Plus, Gwen's Girls is marking the 10th anniversary of the She Matters Equity Summit and Awards. We'll hear about the progress being made and why there's so much to celebrate. And Pittsburgh is the city of bridges, but one woman is working on building bridges between people. We'll explain how. So pull up a chair and meet us at the corner. Intersection starts right now. Hello, I'm Lisa Smith, the Director of Community Impact at KDKA Plus and the host of Intersections. Giving kids and families in Pittsburgh, along with Allegheny and Westmoreland counties, a healthy start is the mission of Healthy Start Pittsburgh. It's an organization started 34 years ago as part of a nationwide project to address increasing infant mortality rates and high cases of babies born at low birth weights, particularly among minority and low-income families. Today, the organization offers access to a number of services for mothers, babies, and families, and they have a big event coming up. It's their biennial Maternal and Child Health Gala. So here to share more details is Jada Sherrill. She is the CEO of Healthy Start Pittsburgh. Thanks so much for being with us today.
Thanks, Lisa, for having me.
All right, so 30 years Healthy Start has been around. What kind of started Healthy Start? Why was there that need for this organization?
So Healthy Start started in 1991. It was a federal demonstration grant started under the George Bush Senior administration, focused on addressing the nation's deplorable rate of infant mortality. So there were lots of reports coming out at that time around why babies were dying before their first birthdays. SIDS, we didn't know that much about SIDS back then. We've made a lot of progress and advances around understanding and preventing SIDS, but in 1991, the Healthy Start project was started federally. There were 15 demonstration pilot sites. Pittsburgh was one of those 15 pilot sites. There are now over 100 Healthy Start grantees across the country. We receive our funds from the federal government, the Department of Health and Human Services, Health Resources and Services Administration, and that grant allows us to address infant mortality as well as other broader maternal and child health issues from a community context.
Yeah. So you talked about infant mortality, but there seems to be I guess the focus is expanding to really not just the babies, but also the mothers. Tell us what you guys do to make sure the mothers have what they need.
Absolutely. So while we've still got to make sure that our babies are safe and healthy, a baby can't be safe and healthy without a safe and healthy adult and community. So maternal health has really taken precedence lately. We're seeing a lot and learning a lot more about the factors that impact women's health and how preconception health, that's what we call the health of a woman or birthing person before they decide to reproduce, if that's their decision. Things from what do we need to do prenatally to be healthy, vitamin intake, getting good, equitable prenatal care, so access to care, making sure that that care is culturally responsive, making sure that physically and geographically that there is care located in communities. We do screenings and assessments, so we consider ourselves to be an extension of healthcare. We are not a clinical healthcare provider. We're a community provider that supports moms and babies' outcomes. So the work that we do is typically in community and in home. So we want to make sure that the participants in our program have their doctor's appointments scheduled routinely and that they can get to them. So we're addressing things like maybe transportation barriers. During the pandemic, for example, folks couldn't, if you had other children and had a doctor's appointment in a hospital, you may not have been able to take those other children, and you may have missed appointments. So working with our health systems to try to figure out how to troubleshoot and address issues like that. We screen for food insecurity, intimate partner violence. When we go into the home and work with our families, we're assessing and we're saying, what else is going on in your life? How can we support you? And how can we take some stress off of you? How can we help you navigate other resources like WIC, other things that you may need, any specialist referrals that you may need. Some folks decide they don't want to birth in the hospital, they want to birth in a birthing center like the Midwife Center, or that they need a doula, or that they hopefully would like to decide to breastfeed, and so we can start that education early. So those are all the things that we do that are focused on women's health, that support improved birth outcomes.
Yeah, and you mentioned breastfeeding, and I think you were telling me that August is Breastfeeding Awareness Month.
Yes.
And you have an event coming up related to that. Tell us about that.
We do. So to celebrate Black Breastfeeding Week, which occurs in August, we have an annual Breast Friend Brunch. That is a time for those who have experienced breastfeeding or who support breastfeeding families to come together and just celebrate and uplift the art and benefits of breastfeeding. And so that is August 23rd. It's at Cohatch on the South Side. And for more information or for tickets, you can visit our website, www.healthystartpittsburgh.org.
Yeah. The other big event you have coming up is your biennial gala.
Yes.
And it's the Healthy Start Maternal and Child Health Gala.
Yes.
Tell us about that.
So we are back, so post-COVID, we are back to holding our gala every other year. This will be our first post-pandemic gala. So the last time we had it kind of right toward the end, and we had Tatiana Lee, who everyone knows her as Ashley Banks, but she is a maternal and child health advocate. And she was wonderful hearing about her work. And so we always try to bring in someone who is going to elevate who we can elevate their work because they're doing great work, but also they can just elevate some of the broader issues around maternal and child health and health equity. So this year we have Dr. Uche Blackstock. She is a trained medical doctor who then turned her career to focus on health equity based on her own experiences. We're going to be honoring some other folks in our community who are focused on making communities healthier. We'll have dinner, we'll have an auction, drink, celebration. We have a wonderful MC, and we'll have a fireside chat with Dr. Blackstock. So that is on September 18th. We are still selling tickets. It's at the Omni William Penn Hotel downtown. It's not too late to buy a ticket to come out and support. It's not too late to have more sponsors added to our list of sponsors. So our two key sponsors right now are Highmark Whole Care and Allegheny Health Network, First Steps and Beyond. We also have a growing list of other sponsors and appreciate the support.
Yeah. And so we're almost out of time, but I do want to note that you guys also are involved in research, right?
Yes.
Why is that important for you to be part of making sure that groups here are included in studying what the needs are for mothers and babies?
Yeah, that's a great question. So when we think about how the Healthy Start initiative started, it started based on research that led us to the conclusion that we need to be doing something about the rates of infant mortality. So as we continue through, this journey 34 years later, there are a lot of social issues and medical issues that impact the health of Black women, babies, families, fathers, and our community. And so given the very dark history that we have in our Black community with research, we understand when there can be a reluctance to participate in research, a lot of distrust, but at the same time, we need to be at the forefront of the research that is going to be impacting our communities. So when we're looking at things like the higher rate of prevalence of hypertensive disorders of pregnancy among Black women, that Black women are more likely to die from preventable causes related to their childbirth, et cetera. We want to make sure when that research is conducted that there are Black women on those research teams, that there is equitable compensation and engagement of community so that it is really good community partnered research. And we also want to make sure that that information and what's learned comes back to benefit community in some way that's bigger than just a gift card and a lunch. Yeah. So that's what we do, is we try to make sure that there is a stronger understanding of why it's important for us to participate in this research, that we're mitigating harm that's being done in our communities via research, and that we are part of the research process and team from the beginning.
Well, we really appreciate you coming and sharing all of this vital information, and much success with the gala, and thanks for all you do. We appreciate you.
Thanks for having me.
All righty. Well, coming up, celebrating 10 years of making sure young girls know they matter. Intersections, we'll be right back. Marking a milestone, Gwen's Girls and the Black Girls Equity Alliance celebrate 10 years of addressing inequities impacting Black girls in Pittsburgh and Allegheny County. They've done it through the annual She Matters Equity Summit and Awards celebration. Joining us to talk more about the event and the release of a new Equity Progress Report are Dr. Kathy Elliott. She's the CEO of Gwen's Girls, as well as Dr. Sarah Goodkind with the University of Pittsburgh Department of Social Work. Thank you both so much for being with us.
Thank you for having us.
So what sounded the alarm, or who sounded the alarm about what was happening as it relates to Black girls?
I think individually, the alarm was being sounded across the city, but really across the country, because 10 years ago, there was an effort to look at the school to prison pipeline and what was it that was causing our young people to be referred to the juvenile court system or, to CYF. And so we started to talk about individually what was happening, but then the foundations were also, trying to understand what was happening. And so the nature of this work is often siloed, and so Sarah was able to come together and pull some of the data together from the various entities that looked at what was happening to young people, especially Black girls in our region, and to develop the report, The Inequities of Black Girls Affected Black Girls in Allegheny County and Pittsburgh. And so that was 10 years ago, and we wanted to look at what has happened since that time. And so probably about a year ago, we started to examine the data, and so Sarah has a report that we have to share this year at our 10th annual Equity Summit. It's been a blessing to still have the engagement of people really thinking about what is best for our girls in our region.
Yeah. So Sarah, what were we seeing and what are we seeing now? There's a change. There has been a shift.
Yeah. So it's been really exciting to look at the data again and revisit some of the same data points we looked at 10 years ago when we found really glaring and troubling inequities affecting Black girls in our region. And what we're seeing now is a lot of progress. There are still inequities, but really, really great progress in terms of fewer Black girls being suspended from school, fewer Black girls being referred to the juvenile legal system, fewer Black girls being placed in congregate care within our child welfare system.
And so now here we are, and you have a celebration that is planned. Tell us a little bit about the 10-year progression of the She Matters and how young girls are able to participate in that process.
Yes, so probably in year 2 or 3, we really understood the need for having the youth voice at the table with us to address the issues, but also to come up with some solutions, because our young people are amazing and brilliant and they have the answers. And so that led to the creation of the Black Girls Advocacy and Leadership Alliance, which we call BAGALA. And so they have been an integral part of the work that we have been doing since then. And so they last year co-convened the summit with us, and they also will be doing it again this year. So it's high school age girls that are interested in just how to learn leadership skills through public speaking, but also just policy change in general, because they want to change what they see that's happening not only in their schools, but in their communities.
Yeah, it's 3 days, right?
Yes.
And then there's also honorees, right?
Yes.
Some awards. Tell us
Right.
a little bit about that.
So on Thursday evening, we have a celebration celebration of people and entities that have given back to not only Gwen's girls, but women and girls in general in our region. And so we're excited to celebrate them. And then on Thursday and Friday is the actual summit. We have a keynote speaker who will be, she's the president and CEO of the Men's Foundation, Teresa Younger. We also have a few other speakers, but the highlight, I think, is the report will be introduced. Sarah will give an overview of the report, but we also will have a panel discussion similar to what we did in year one before even the Black Girls Equity Alliance was formed, with system leaders who have been an integral part of making sure that the success and progress that we see, they've been a part of that. And that's why this year we're celebrating that collective impact. Hasn't been just Gwen's girls or just one or two entities. It's been a collaboration throughout the years of how do we change policy and have solutions to better support our girls in the home, in the school, and in our community.
And give us that date for the event.
So the awards celebration is September 4th at the Sheridan Station Square, and then on the 5th and 6th of September is the summit.
Okay, and then very 10 seconds, Sarah, where are we headed? Where are we headed with the girls?
Well, I think we're headed in a good direction. I think we need to keep working together, which is why we're still doing this work, but I think we in our region are finding ways to support girls and keep them out of some of these systems.
Right.
Especially with the national policy changes that have come down, it's very important that we stay abreast and informed of what's happening within our various systems that impact our girls.
Yeah. Well, thank you both so much for all the work that you do, and best of luck with the upcoming event.
Thank you.
Thank you.
All right.
Well, coming up, an event aimed at bridging the gaps in Pittsburgh. Intersections, we'll be right back. Well, Pittsburgh prides itself on being the city of bridges. But the question is, how do you build bridges? One local woman is working to get us to think about that question and act it out in ways that make us and the city more accepting and inclusive. Ebtahal Badawi is the creator of the Pittsburgh Builds Bridges initiative, and she is the organizer behind the 3rd annual Building Bridges Day. Thanks so much for being with us again.
Thank you so much for having me.
Yeah. So just give us a little bit of why this became something that was important for you to do in terms of getting people to come together and find their similarities and ways for them to come together.
It started 6 years ago. My son, when he was younger, he got some racism comments, and they eventually apologized to him. As a mother, it hurts that my son went through that. And I also thought of the other person, what they've been through to do something like this. The same year, I saw a Syrian refugee was beaten up in one of the high schools in Pittsburgh. And I also thought, how can I use my art to bring people together, to heal together? And that's where it all started.
Yeah. And so part of this is the art, and you have people, paint on, the bridge. Tell us a little bit about some of the people who've been able to participate. I know you have this picture here that had some significant people be part of that one.
It's almost more than 5,000 people across the county from different walk of life, and like kids, adults, and in this canvas, it's dear to my heart because different people came together and painted it, added that brushstroke, and one of them, he's one of Pittsburgh legend, Franco Harris, and I invited him to add the brushstroke, and he shared with me that he's not an artist, but he still did it, and he shared how he built bridges.
Yeah. So that question, why that question? Is it to make people think? Why do you want people to answer that question?
It's because everyone have their unique experience and their own stories. And I believe when you really go in your heart and share your own story, it brings people together.
So you have Pittsburgh building bridges where people come out on the Clemente Bridge, and there's all these activities. You have another event coming up this year. Tell us about the event, what people will see when they come, you know, and what do you want them to experience?
This is our third annual, and it will be on the Clemente Bridge from 9 a.m. to 1 p.m. We will have a kickoff walk, Let's Walk Together, to build bridges of peace, led by City Girls, a nonprofit that promote women to walk. And we will have, for the first time, mascot race for high schools. And the winner mascot will get a $500 prize from P3R. So if you're a mascot in a high school, you come and join us. So this is like new things that we will have. And we will have yoga with Sally Sherman. She's been doing yoga with the Pittsburgh Pirates ballpark. And through the day, we will have a different performance from different cultures. And for the first time, we're gonna have the African band Balafon perform a unique dance with the Irish band Chevalon, and to experience how can we cross cultures.
Yeah, and I believe you said last year, maybe, was it 1,000 people last year?
Yeah.
Somewhere in that range, yeah. What do people say, you know, after the experience?
So also in the event, we encourage people to talk to each other, and if you connect, make and have a new friend, build a new bridge, you will get a free cup of coffee. So for the past 2 years, we've been doing that, and people start talking to stranger, talking to someone new they never thought in their life they will be talking. So that's the experience that people had this past 2 years, and that's what they share after the event, that they have made new friends at the event.
Yeah. Well, it's August 23rd, right?
Yes.
Saturday, August 23rd, and we have the information on the screen, and people can just come. It's free, and hopefully you'll have another wonderful turnout. Thanks so much for being with us. We appreciate it.
Thank you.
All right. And I'll have my last word when we come back. Potential. It's all about the possibilities, what could be, what we're capable of. You can have the ingredients, but without an oven, the cake isn't baked. Sometimes it takes someone else seeing your potential. It could be a delicate balance, but the key is not to let your potential go to waste. Thanks for watching. We'll see you next time on Intersections.